we age, we see a change in the way the face looks. We have a downward drift of the cheeks. We develop more prominence of these, what we call nasolabial folds, and jowl formation, in addition to lines and wrinkles around the face. So it's now possible with the liquid facelift to resculpture the face, to get a lifting and an elevation in a way that we could only do before with surgery. And today I'm going to demonstrate on this patient how using a variety of different fillers, the cheeks are going to be elevated, the folds are going to be softened, the jowl line will be less prominent, and then we're going to soften lines around the eyes and the forehead. So now what we're starting is what I call the liquid facelift. So we're first going to take care of the crow's feet, glabella, the forehead, and anything in the platysma. I'm going to have Cynthia make some expressions. I've pre-alcoholed everything, and we're ready to go. The idea is not to eliminate all the lines, it's to soften them, because you don't want the unnatural look. So that takes care of the Botox, and we're just going to put a little ice on these areas to help vasoconstrict and minimize bruising. Now the next step is radius. We're going to use radius to give better definition to the cheeks, because as you age, the soft tissues drift down. So I use a technique that actually goes inside the mouth, and this allows a very natural elevation of the cheek on both sides. So I do put a little bit of numbing medicine in the mouth. Now this is the radius, and radius does have some lidocaine in it, so as it's being put in, it's less uncomfortable. And that's that side. And then I mold it a little bit, sculpture it. Put ice on this side. Now we go to the next side. I've already put the lidocaine in the mouth, so she's had a few minutes for that, and it's very nice. Okay, so that takes care of the cheeks, the elevation. Now the next part is going to be the nasolabial folds, which are so critical. So I'm going to be putting Juvederm in this area, which is a hyaluronic acid base. It's much softer. Radius is hydroxyapatite, and it's firmer. That's why I like to use it to rebuild the cheekbone area. But in this area of the nasolabial, around the lips and in this jawline, I like to use something a little bit softer, and that's Juvederm. So we have alcoholed this area, and in the new Juvederm there is lidocaine in it, so as I'm doing it, it's actually less uncomfortable. And I'm also, while I'm here, I'm going to improve this jawline over here, where you sometimes can get a little telltale sign of the jowls in this area. Now sometimes people also want a little bit in the lips, but I don't. But Cynthia doesn't. So the right side is done, and now I'm going to move to the left side, and I'm going to do it in similar fashion. Just to give a little wrap up of what we did today in the liquid facelift, you had Botox in the crow's feet, glabella, forehead lines, and also with the platysma banding to help soften the neck. And then she had fillers, so I put Radius, which is a hydroxyapatite base, it's firmer. That went into the cheek area, and then I used hyaluronic acid based Juvederm for the nasolabial folds in the perioral region, and then often that jawline. How do you feel, Cynthia?
I feel good.
Yeah.
I feel great.
Yeah. So, Cynthia, you're raring to go.
I am.
Yes.
I feel wonderful.
Right.
I can't believe it only took a short time. I can go back to my work,
Right.
and no one would know the difference.
No, except that you look better.
Except that I look better.
Best of all.